Hi, I'm Paige Lampy. This is Morgan Rika. She's going to be sitting in as a mock patient for my outcomes research video. She's sitting in as Miss Smith, who is a 40-year-old high school teacher who presents with tired and weakness, as well as small red dots on her skin and gums. And she recently found, as she was cooking in her kitchen, that a wound didn't heal as fast as normal, so she bled for a very long amount of time. And so as her physician today, I'm just going to be talking to her a little bit about what thrombocytopenia is and how we go about diagnosing that. So thrombocytopenia is actually a condition in which you have a low blood platelet count, and this is crucial because platelets are for healing cuts, making sure that you don't bleed out, just kind of dealing with the healing process of your body. So when you don't have enough, it's hard to get back to normal or fix cuts or any type of harmful thing that has happened to your body. Platelets are kind of your fighter. So do you have any questions about thrombocytopenia?
I do. How exactly do you go about diagnosing this?
So it's actually a relatively easy process. What we're going to do to you is just a regular blood test, so it'll be intravenously. You'll just go to the hospital and they'll probably take a few blood samples from your arm, and we'll test it for platelet count to see if you're in the normal range, which I think is about 150,000 to 450,000. And if you fall below that, we know that you probably have thrombocytopenia. As well as a blood test, I'll be asking you kind of history of your physical exam, whether you have bruises that don't go away, or might take imaging of your spleen to see if it's enlarged, or if there's any type of internal bleeding that we might suspect. That's a huge indicator of thrombocytopenia.
Okay, so what exactly does this diagnosis mean for me then?
So complications kind of that arise with thrombocytopenia is just the risk of internal bleeding. So when you get this diagnosis, what you should be on the lookout for, what the worst case scenario is bleeding internally. And obviously when you bleed internally, you don't want that to reach your brain, because any type of bleeding internally that's in your brain can in turn be fatal. And this is a severe and very, very rare consequence, but getting thrombocytopenia treated at the very beginning gives you a better chance to avoid that.
Okay. So another question, how exactly do I treat this? Like, what do I do? What are you going to do for me?
So what we'll start with will probably be a different kind of combination of medications and blood transfusions.
Okay.
So just kind of an analogy would be kidney patients go in and they kind of have dialysis. And this is similar in the fact that we'll be taking blood from your body and kind of pumping it through a machine, adding platelets to it, and just making your blood more wholesome. That way your cuts heal, and within 1 to 2 weeks, I would like to say that your symptoms will go away and you'll start to feel a little better. Mm-hmm. And as well as the platelet transfusion, we'll be giving you medicines.
Okay.
So thrombocytopenia really deals with the immune system, and so what we want to do is fix that problem, obviously. So we'll start with a corticosteroid, and we may even add a medication to suppress your immune system so we can really target the platelet production and adding those back into your blood to make sure that you will bounce back. Mm-hmm. And if we don't see any type of benefit from the medication and platelet transfusion, the most extreme case would be surgery. And what we would do in surgery would be remove your spleen, which is very common. People get their spleens removed in car accidents or whatever. But in thrombocytopenia, it's really kind of rare to have surgery. But if we needed to do that, we could get you there. And plasma exchange would happen whether you had surgery or not surgery. And just plasma exchange kind of goes hand in hand with platelet transfusions.
Okay.
And so it's just ensuring that there's going to be enough plasma in your blood that your body can heal itself, because if it can't heal itself, you'll never get back to that norm. Mm-hmm. So whether you have surgery or not, we'll be giving you plasma transfusions just to ensure your blood is more wholesome.
Okay.
Do you have any other questions?
I don't think so. Thank you.